My name's Ian Rummery and I'm a registered mental health nurse. I work on the island of St Helena, which is a British overseas territory. St Helena is one of the most remote communities in the world, a small island about 10 miles long and 6 miles wide. It's in the South Atlantic Ocean, almost halfway between Africa and South America, and has a population of just over 4,000. I originally trained in Australia, graduating as a mental health nurse back in 1991. And I admit that I'd never really considered being a nurse until I saw the advert for nurse training. And this was obviously back in the day of hospital-based training when you were paid, and it was the fact that I was going to be paid that really got my attention and motivated me to apply. After graduating, and for a number of reasons, I wasn't that thrilled about embarking on a career as a nurse, but having got the ticket, I figured I might as well use it, and it had to be better than being unemployed. So after a succession of jobs in Australia, I moved to the UK. In 1994, I went travelling and visited St Helena for the first time. For some reason, I don't know why, I'd always wanted to go there, and in those days, the island was even more remote as it did not have an airport. So it was a 14-day voyage on the island's ship called the RMS St Helena from the UK to the island. I met Belinda, now my wife, on the ship, and Belinda was from St Helena. She was visiting her family as she was in between jobs in London. So, after my travels and returning to England, I too moved to London. But, there was just something about St Helena that had got under my skin. I was determined to go back there and live, but I just needed to convince Belinda to come with me. It took a while, but we moved out there in 2003. But during this time in England, I worked in all sorts of nursing jobs. I worked in the NHS in the private sector. I did agency. I was a bank nurse. Had a couple of full-time posts and covered everything from general psychiatry, day hospitals, nursing homes, substance misuse units, and learning disability. And I guess I hope that in all those jobs I worked hard and was a competent nurse, but there was still something missing. I didn't feel that I was achieving much. I felt more like I was just processing people than caring for them. Like I was on the assembly line moving patients from point A to point B, but never really being with them on the patient journey. Somewhere along the way, I developed a sense that I should be making a difference, whatever that means. But I just seemed to be part of a system, the proverbial cog in the machine. So having finally convinced Belinda, we moved back, as I said, to St Helena in 2003. At the time, I was the only qualified mental health professional on the island, and I wasn't sure what to expect, but I learned early on that you had to be resourceful and resilient. The comfort of being a cog in the machine is that if you encounter problems, you can try and find someone else in the system to help. Not so on St Helena. In terms of mental health, I was it. That's not to say that I felt unsupported, as people rallied around and my St Helenian colleagues were and are fantastic. But back then, with only the most basic of a dial-up internet connection, doing research or accessing a second opinion or even having a clinical discussion with someone else was very difficult. But, as I learned, with perseverance, it was possible. There were times when I would search out and contact details for psychiatrists and psychologists and just ask for advice. My opening line in the email was always, "I'm a mental health nurse on this remote island of St Helena, and I have a patient who is," and I would go on to describe their symptoms. And I remember once feeling completely overwhelmed trying to support a person who was in the darkest depths of depression. And as luck would have it, I just read a book by an American psychologist on what's called refractory depression, that is, depression that does not respond to the normal course of antidepressants. And the doctor on the island and I had looked at combinations of antidepressants, but we still did not feel completely comfortable with the medication regime that we were proposing. So I sent this psychologist an email. To my surprise, a few days later, my phone rings and this psychologist is calling me from America to talk through the case. This psychologist, an international expert in this field, took the time to discuss with me our plan and gave us the confidence to implement this medication regime. And I'm pleased to say the patient recovered. And over the years, mental health services on St Helena have expanded, and I now lead the mental health team, which, when fully staffed, consists of myself and 2 other mental health nurses, a psychologist and a support worker. The qualified staff are on contracts and usually spend 2 to 3 years on island. We're busy, busier than you would imagine with a population of 4,000 people, and there's always one of us on call. In addition to the mental health care, we provide general and mental health care to detainees in custody and the inmates in prison. But I'd just like to share with you some of my more personal reflections of living and working on St Helena. Because in a community of 4,000 people, you may not know everyone, but you know most people or their families. So people are not a number. They're part of the same community that you live in. One day you can be in the clinic counselling a person who's struggling, and then the next day, in a completely different context, you're at a meeting where you are interacting with this person in their professional capacity. And from the start of my training, I was never comfortable with this notion that when one worked therapeutically with a patient, that you should keep it impersonal on your part, that it was okay to delve into the lives of another person, but never really reveal anything of yourself. Of course, there has to be some professional boundaries, but it always struck me as fundamentally dishonest and unequal to expect someone to share their most intimate details with you while you remain impartial. Well, in St Helena, or indeed other remote communities, good luck with staying detached. You know, when new staff arrive, they're amazed at how quickly the community knows who they are and where they come from. It can be disconcerting at first, but it comes with living in a remote community, and you just have to adjust. I also believe that it is these close personal connections that are fundamental to the strength of our service. It is this blurring of boundaries, that I work therapeutically with people, but I'm also a member of this tight-knit community that I find so rewarding and at times challenging. And it's only since I arrived on St Helena that I believe I was able to develop very strong and meaningful therapeutic relationships. That my relationships with the people I support to recover from mental health problems are multifaceted, complex, but ultimately I believe that it is the therapeutic relationship that is the foundation on which recovery is built. And anyone who wants to contact me on St Helena will know where I live, or will be able to find my phone number. And sometimes people call me at home. Occasionally, when in distress, a person will knock on my door. And I can't refuse to talk to someone or turn them away. I may agree to see them at the office at a later time or date, but in a crisis, I need to support that person at the time they're asking for help, regardless of how they ask. And often, we'll support people in what could be considered technically non-nursing duties. This might include helping people with their shopping, advocating for them if they have to go to the benefits office, or perhaps just giving them a lift so they can go and visit relatives. And while this may seem outside of our scope of practice, I maintain that these are essential activities as they add to the person's quality of life. Even more importantly, they build trust and a sense of security. So if there is a crisis, we're more likely to be accepted by the person as someone they can relate to. I remember an incident, it happened in the early hours of the morning, where a person with severe and enduring mental illness was relapsing, and they'd become quite paranoid, to the point where they'd locked themselves in the house and weren't letting anybody in. So the police were in attendance, and when I got there, I was able to convince the person to let me into the house and then take them to hospital. And I believe that despite their paranoia, we had such a strong relationship that the person trusted me to help them in this time of crisis. And fortunately, I was able to avoid the person being sectioned as they agreed to stay in hospital. And this is what I was missing all throughout my nursing career prior to coming to St Helena. The opportunity to be involved, really involved in a person's journey through the highs, the lows, the setbacks and the achievements. Not everyone recovers in the sense that they're able to overcome their mental health challenges. Not everyone wants my support. But being part of this community means that I can be there for people when they ask for help. Sometimes it's about being available when the person is ready to talk. There are a number of people who've dropped in and out of our service over the years in crisis, only to one day sit down and disclose what has happened to them. Often it's abuse or trauma earlier on in their life. But to be present when a person finally says, I need help is humbling, because I know how difficult it has been for them to ask for this help. I could not imagine that when I started out as a nurse and ended up living and working in one of the most remote communities on the planet. All I know is at the beginning of my nursing career, there were times when I wanted to quit nursing altogether, but I kept trying different jobs until I eventually found the one that just seemed to make sense. And this is, I suppose, the moral of this story. I get that working in a remote community might not be your idea of the dream nursing job, but don't ever give up looking for your dream job in nursing. In a strange way, all those different nursing posts I had before going to St Helena prepared me for working on the island. As I'd experienced in different fields of nursing, I was well placed to take on the challenges of remote area nursing, where you kind of need to know a bit of everything. And if you don't know, you keep looking until you find an answer.